CBT Practice Test 2026 Computer-Based Tests Certification Exam Questions and Answers. Question 1. What are the 6 Cs of nursing as defined by the NHS? Care, compassion, competence, communication, courage, commitment. Care, control, cost, cleanliness, comfort, caution. Cure, calm, capability, charity, concern, clarity. Check, clean, change, consult, correct, complete. These values are central to the nursing profession in the UK. Question 2. A patient is prescribed 500 mg of a drug. The available dose is 250 mg per tablet. How many tablets should be given? 1, 2, 3, 4. 500/250 equals 2 tablets. Question 3. Which of the following is an early sign of pressure ulcer formation? Skin is intact but red and does not blanch. Bleeding from the site. Presence of a deep cavity. Greenish discharge. Non-blanching erythema is the first stage. Question 4. When performing CPR on an adult, what is the recommended compression depth? 1 to 2 cm, 3 to 4 cm, 5 to 6 cm, 8 to 10 cm. The UK Resuscitation Council recommends a depth of 5 to 6 cm. Question 5. What is the gold standard for verifying the position of a nasogastric (ING) tube? Auscultation of air, pH testing of aspirate, pH 1 to 5, asking the patient to speak, observing for bubbling in water. pH testing, followed by X-ray if pH is inconclusive, is the standard. Question 6. Under the Mental Capacity Act, what must be assumed about every adult? They lack capacity. They have capacity until proven otherwise. They need a lawyer. They cannot make decisions. The first principle of the Act is the presumption of capacity. Question 7. Which of the following is a sign of anaphylaxis? Itchy skin only, high blood pressure, stridor and wheeze, bradycardia. Respiratory distress and hypotension are hallmarks of anaphylaxis. Question 8. What is the correct sequence for donning PPE? Gloves, gown, mask, eye protection. Gown, mask, eye protection, gloves. Mask, gloves, gown, eye protection. Gloves, mask, eye protection, gown. The recommended order is gown, mask, goggles, then gloves. Question 9. According to the NMC code, what is the primary duty of a nurse? To save money for the hospital. To follow doctor's orders without question. To make the care of people your first concern. To finish all paperwork on time. Prioritizing people is the core requirement of the code. Question 10. What is the News 2 score used for? To calculate nurse salaries. To track patient satisfaction. To identify and respond to clinical deterioration. To measure bed occupancy. National Early Warning Score, News 2, tracks physiological parameters. Question 11. A patient with COPD is prescribed oxygen. What is the typical target saturation range? 94 to 98%, 88 to 92%, 98 to 100%, 70 to 80%. For many COPD patients at risk of hypercapnic respiratory failure, 88 to 92% is the target. Question 12. What is the purpose of the yellow card scheme in the UK? To report staffing shortages. To report suspected side effects of medicines. To identify patients with allergies. To mark dangerous equipment. It is for reporting adverse drug reactions, ADR. Question 13. Which of these is a never event in healthcare? Patient falls in the hallway. Wrong site surgery. Delayed discharge. Medication error with no harm. Never events are serious incidents that are entirely preventable. Question 14. What is standard precautions in infection control? Only washing hands after touching blood. Applying the same basic level of infection control to all patients. Using a mask for every patient. Isolating all patients with a cough. They are used for all patients to prevent cross-contamination. Question 15. When should a nurse escalate a patient's care based on a NEWS2 score? Score of 0, score of 1, score of 5 or more, or 3 in a single parameter. Only if the patient asks. A score of 5 or more triggers an urgent clinical review. Question 16. What does SPAR stand for in clinical communication? Situation, background, assessment, recommendation. Safety, belief, action, response. Symptoms, bloods, analysis, review. System, basis, area, results. SPAR is a structured communication tool. Question 17. What is informed consent? The patient signs a paper without reading it. The patient agrees to treatment after being told the risks and benefits. The doctor decides what is best. The family gives permission for an adult. Consent must be voluntary and informed. Question 18. Which position is best for a patient with acute respiratory distress? Supine, flat on back. Prone, on stomach. Upright/high Fowlers. Left lateral. Sitting up allows for maximum lung expansion. Question 19. A patient is found unresponsive and not breathing. What is your first action? Start chest compressions. Check for a pulse for 60 seconds. Shout for help and pull the emergency buzzer. Call the family. Safety and calling for help are the first steps in basic life support. Question 20. How often should a peripheral 4 cannula site be reviewed? Every week. Every 24 hours. At least every shift/daily. Only when it leaks. Regular assessment using a tool like the VIP, Visual Infusion Phlebitis, score is essential.